I am joined now by Dr. Anthony Fauci from Maryland. He's the director of the National Institute of Allergy and Infectious Diseases at NIH. Dr. Fauci, the WHO decided not to declare an international health emergency for now, but could that change? Because there have been some pretty strong arguments to declare it.
Well, I don't disagree at all with their decision. What the point that they were making is that the spillover into Uganda, which was almost inevitable with porous borders, was very well controlled and addressed by the Ugandan officials. There was no secondary or tertiary spread within Uganda. So even though it did cross borders, the overall reflection on the matter really led them to come to the conclusion that they may make actually matters worse by declaring that emergency because of the restriction of travel and things that would negatively impact the DRC. So it's understandable that people might raise their eyebrows about why they did not declare the emergency, but there are pretty good reasons why. And as I mentioned, I don't disagree with them at all.
Well, what have been the challenges this time compared to the last Ebola outbreak in Africa in 2014? What is different, and can you use the same strategy to combat this outbreak?
Well, certain parts of the strategy are the same. The thing that's really different in this now northeastern part of the country as opposed to when it was in the more western part of the country is the violence that's associated with this. That it's really dangerous for many of the responders to get out, administer the vaccine, and do the kind of contact tracing that they do. That's the problem.
So that is something that is trying to be addressed, but really what can you do to address that situation or to, inform people that, they really need to get vaccinated and at the same time protecting healthcare workers?
Well, it's not going to be easy because the violence is related to things that are very diffuse. It isn't as if there's one ideological group there that's against the people who are doing the vaccination. There are multiple militias that are involved that are really almost like the Wild West. It's very, very difficult. And if you go in there with security, with guns, it might make things worse. So the conclusion is we need to engage the community in a much more intense way to get them to buy in to what we're trying to do. It has not been easy at all because there's been great distrust among the community of people coming in from the outside and trying to stop an epidemic that they have great suspicion of. They kind of think that maybe that epidemic was thrust upon them by outsiders. It's very difficult to get them to understand that we're trying to help them and not make matters worse.
More than 1,000 people have died in this outbreak since last year. With the current situation, do you think that the outbreak is becoming more controlled, or will it get worse before it gets better? What's your assessment?
Well, I'm not sure it's going to get worse before it gets better, but it certainly is not under control. And whenever you have an outbreak like this that is not under control and not going in the right direction, there is always the danger that it will get worse. If not worse in magnitude, certainly worse in the sense of persisting, because we certainly should have had this under control some time ago, and it very well may be there may be many more months, if not a year or more, before we actually get it under control.
All right, Dr. Anthony Fauci, thank you.